So this is before the test.
Okay.
And so if you could describe to me what's going on with you.
Okay. My name is Carol Brown, and I have diagnosed RSD or CRPS in my upper extremities, and within the last 3 months it's been spreading to my lower extremities, mainly my feet and halfway up my calf. The pain, I can describe it as burning, constant burning, constant aching, swelling in the fingers, forearms, and shoulders, extreme sweating, accompanied with coldness in the hands, dystrophy, tremors, muscle spasms, and this is all in the upper extremities, and a lot of stiffness. And in my feet, I experience burning on the balls of my feet and achiness and sharp pains that shoot up my calf, and they also swell every night. So
The calves?
my feet.
The feet. And how long has this been going on?
The RSD was diagnosed about 14 months ago in my hands, and then recently within the last 3 months in my feet. But I've had a 4-year battle with my upper extremities, in which I've had 3 corrective surgeries, over 20 cortisone shots, 3 nerve blocks, and a lot of PT.
Wow. And do you have any idea what started it, or?
I worked as a data entry clerk for a metal fabrication company, and I did about 6 hours of strictly 10-key data entry every day.
Wow.
For 3 years.
For 3 years. And then it came on after that? Or
yes.
Did it progressively come on, or did it just suddenly happen?
No, it just suddenly happened one day. I woke up and I could barely move my arm. My hand was swollen. My forearm was swollen. And I basically could not move it from the protective stance underneath my breast, tucked between my breast and stomach.
Wow. Wow. And no auto injuries or slips and falls or anything in addition to that, or?
No, I had an injury when I was 16, approximately almost 15 years ago. That's it. Other than that, I'm very healthy. I was very active. I'm an avid boater. Love to play softball. Love to do cardio exercise. I used to work with children for 10 years, so very active in after-school programs, volunteering at my son's school. And now, as a result of all my injuries, I'm kind of dormant. I don't have any hobbies. I can't volunteer anymore like I used to, and I require a lot of rest because I'm always fatigued because of the pain.
Oh, sorry to hear that.
Oh, well, hopefully we can change that.
Let's see what we can do. Okay, so after the first part of the testing here, can you tell me what changed, what you noticed?
When I first came in, my legs and my feet were really cold. So during the first test, I felt heat going down to my legs, and my jaw was definitely less stiff than it was before, and the stiffness in my neck has definitely loosened up. Felt like concrete before. It feels a little more pliable now.
How much improvement would you say there's there?
I would say about 30%.
30%. Wow. Wow. And so that's good. And how about as far as your legs go?
My legs feel definitely a lot warmer than when they came in. When I came in, they felt like ice blocks. They feel a lot warmer, definitely in the calf area where I usually get the first sight of pain when they're getting ready to flare up. That's a good sign because the coldness is usually followed by stiffness and swelling. Mm-hmm. So the heat, definitely I can feel it in my calves now.
So does it feel like back to normal heat, or
not back
percentage?
to normal, but definitely less. The pain increases over an entire day, so basically this will slow down the normal progression of the pain.
And that happens in your arms too, as far as pain during the day?
Yes, yeah.
Okay. So we did the second half of testing. And so tell us about the experience with that.
The second half of testing, my feet were just a little bit colder, but not as cold as they normally are. And I felt a little bit of heat going to my hands. My hands were definitely warmed up. And during the second treatment, I felt heat in my head, if that makes any sense. I felt like heat on the back of my skull.
And jaw-wise?
The jaw is still nice and loose. It feels a lot better than it did in the neck, too.
All right. So does the neck feel a little better than even after the first half?
Yes.